So hello and welcome everyone. Thank you for making the time today to join us to learn more about oral health. I'm Tara Wilson, the Health Education Implementation Specialist with Lundin Health Education Alliance of Maine, a program of Mass General Hospital in Boston. With me today are my colleagues Labrini Nelligan and Samantha Knock. Since 2011, Lundin has been providing education on critical public health problems where we know education gaps exist. This organization was made possible through the vision and generosity of both Mass General and the Lunder Family Foundation. Our charge has been to improve health by providing continuing education and support to healthcare professionals. The funders had strong ties to Maine, hence the Maine focus. This has been a unique initiative connecting a major academic medical center in one state with neighboring nearby rural state. For the first 10 years, we primarily developed programs for healthcare professionals. However, over the last several years, we've created complementary materials and learning opportunities for patients and consumers. Most recently, we've developed a totally consumer-focused program titled Motivate at Home. Today's session is a component of that program entitled Ask the Dental Expert. We piloted this program component at the end of last year, and it was well received. Next slide. And as a reminder, this educational program is being recorded and will be shared broadly as an enduring educational opportunity. Today's session will be 30 minutes, and all participants are muted and videos are turned off. However, we do encourage questions, so please, if you do have a question, you can unmute yourself, raise your hand, or enter your question in the chat box. Also, your feedback is very important to us and will help shape future iterations of this program. At the end of today's session, you will see a survey link in the chat box that we kindly ask you to complete. Next slide. And please take a moment to read this disclosure. This is an educational program and is not intended to render any medical advice. Next slide. So let's begin. Today is the fourth of this year's series of presentations for our newest program, Motivate at Home. Motivate stands for Maine's Oral Team-Based Initiative, Vital Access to Education. This new program reaches a new audience of caregivers of older adults that reside at home. This new program teaches the importance of oral health and also teaches caregivers what their role can be for promoting oral health for their older adult loved ones living at home, even if they don't provide hands-on care. This program was funded by the CareQuest Institute for Oral Health and modified from our nursing home program, which is now published in the Journal of Public Health Dentistry. This program is web-based, but our pre-program survey results revealed that while a website is convenient and preferred by most caregivers as a means to learn, some respondents also wanted live, face-to-face time with dental experts, hence Ask the Dental Expert series. This next 2-minute video will explain the Motivate at Home program in greater detail and how it was shaped by caregivers and other stakeholders.
Hi, I'm Carol Higgins-Taylor. I help and provide support for my mother, who's in her 90s, even though she still lives independently. It's called being a care partner. If you're a care partner like I am, you might be interested in participating in a new program, Motivate at Home, which is very helpful. I love that the program was developed by health experts and organizations right here in Maine, so they know Mainers. The program is designed to teach people how to provide oral care for a loved one. Even if you don't personally provide this direct care, you'll learn how to promote oral health care for your loved one and others who may be in their situation. Caregiving and care partnering can be difficult. Like me, if you have conflicting feelings about your loved one's oral health or lack thereof, what I've learned is that it's never too late to address oral health. It's better to start somewhere and do something than do nothing at all. This program helps get you started. The initial Motivate program was developed for health professionals who care for nursing home residents. The videos and posters from that program were modified for people like us who are care partners. They created a survey, held focus groups, and spoke to care partners across the state when developing the Motivate at Home program. The best part is that the Motivate at Home program is free. This website is very easy to use and has all the education someone needs to complete the program. There are no other books or materials required. The website has brief videos, posters, audio recordings, and other resources. The videos can be viewed at any time at your own pace, and the posters dispel common oral health myths. You'll learn tips for providing oral care for someone who has dementia or is otherwise resistant to care.
I'd like to now introduce our two dental experts for today's session, Drs. Brennan and Foster. They both serve as generous volunteers on our Motivate program statewide advisory committee and often serve as faculty for our workshops. Dr. Nancy Foster is currently an associate professor of dental health at the University of Maine at Augusta Bangor campus. She also practices clinical dental hygiene part-time in Bangor at a practice limited to periodontics. She has served on the Maine Board of Dental Examiners, as well as held a position as a clinical research co-investigator at Boston University Goldman School of Dental Medicine. She worked with both industry and governmental entities on a variety of research projects and co-authored several articles on periodontology and dental hygiene. Dr. Brennan is a faculty member at the Harvard Dental School, a mentor and geriatric specialist for Harvard's Nurse Practitioner Dental Interprofessional Model, the Oral Health Workforce for Rural and Vulnerable Populations, and for the Predoctoral Oral Health Education and Training for Aging in America. CNN Money Magazine recognized Dr. Brennan with the 2014 Hero Award for his work with the elderly and other fragile individuals. Dr. Brennan practiced general dentistry in Portland, Maine for almost 40 years. So I'll now turn it over to our guest speakers. Thank you.
Thank you, Tara. Dr. Brennan, do you want to jump in with our first slide? I think you're muted.
There we go.
There we go.
Well, thank you for joining us today. And one of the reasons I think these types of sessions is so important is that one of the models and of Motivate is you give power through education. And things have changed so much in the world of oral health. And one of the concepts is that oral health is just not a mouth problem anymore. It's related to the rest of the body. And so it's a team approach. So when you look at this slide, you see the mouth on the left side, and you see all the other organ systems, some of the organ systems that it affects. So it's important that people that are patients and caregivers and providers like cardiologists and endocrinologists are aware of how the mouth affects other parts of the body. I think it's also important to look at when we're looking at care at home is that in the demographics of this population is that 70+% of patients at home are dentally unstable, which means that they have a significant amount of gum disease and caries and other types of infections. And so the reason that is important is that home caregivers have a really important role in caring for the mouth or assisting in care for the mouths of loved ones. The other part of this type of a program is not only to empower patients to ask the right questions about their health, but also to know who they can ask questions for. The last time we did Ask the Dentist, there was Dr. Rod Larson was on. There's a number of people that you can ask questions about your medication, about your oral health. So I'm hoping that when we leave today, know that your mouth is attached to other organ systems, and there's a lot of new information even in the last year. And to get the information that you need, there's a team that you can ask. I think it's really important also to realize that most of the older adults in Maine and around the country cannot afford to go to the dentist. So a lot of those questions need to be asked to your primary care docs, your healthcare team, pharmacists, and other healthcare providers. Next slide, please.
And so just sort of give us a background of how this all works, how the mouth is connected to the body. So we're all familiar with bacteria and the toxins that those bacteria cause in the mouth, but not only in the mouth, but the lips, the throat, the teeth. Those bacteria, believe it or not, a lot of people don't realize they actually travel through the mouth into the bloodstream. They also is in saliva. So those bacteria causes issues or diseases elsewhere in the body. And we've seen, like on the previous slide, give you all the different organ systems that are attached, but the brain, the lungs, the heart. It also impacts diabetes and blood glucose or sugar control. And again, so those toxins, if they're able to be controlled in the mouth, it does help with other organs or keep our bodies healthier, especially as we age and as we get older. Kind of like the big picture, the connections of the mouth and the rest of the body. Because I think sometimes, Dr. Brennan, if you agree that people, I think sometimes thinks of the dentist as a separate office or a practice, and then your medical doctor and the hospital is separate, realizing that what we know now through the literature, that it's all connected. It's that the mouth is and that dentists and dental providers are healthcare providers, just like the practitioners at your medical office or at the hospital. And we're learning more and more. It's really exciting, the science that's being published and coming out on this very topic. Want to run to the next slide?
Well, when Dr. Foster had mentioned, was talking about the bacteria in your mouth, visualize that the bacteria in your mouth double every 5 hours. So, and when you think about that, we go from millions to trillions in a very small period of time, within a couple of days. So if you have loved ones at home and they're having difficulty brushing their back teeth or their front teeth, these millions of bacteria can turn into trillions of potential pathogens. The more bacteria in your mouth, the more that they can travel to these different organs that we talk about. So it's very important to kind of visualize how fast they can grow, not only on your teeth and your gums and on your cheek, as Dr. Foster had mentioned, but do you ever think about the bacteria in your dentures or your partials or your mouth guards? Or how about your toothbrushes? So we have a whole package of bacteria that's in your mouth. And so one of the things that we want to look at is that, to leave with, is that it affects other parts of your body. But generally, we think of the mouth, or people thought about the mouth as being just a mouth problem, that it can cause cavities, like you can see in this picture, or it can affect the gums, as this picture, or the lips or the tongue. And that has really been sort of the focus of medicine and dentistry for years. We have been separated or siloed, where dentistry did the mouth and the healthcare providers did the rest of the body. And what's happening today is that they're joined, as Dr. Foster had talked about, that you can't separate these two. So not only do they act locally, as you'll see in a few other slides, they act elsewhere in the body.
And then, like this picture presents, again, someone with serious cavities in their mouth, and some of the challenges of, things that come with it, like pain, discomfort. Sometimes patients I've seen that have mouths that look similar to this, sadly, they are not in pain. So pain isn't always correlated with or realizing that someone has a cavity or has gum disease. A lot of times those things can be silent, or they're silent until they're really severe and then require more advanced, like a surgical extraction, a tooth pull, and alike. So those are some of the things I think some people may not be aware of. They wait till things hurt before they connect with a provider. And so prevention, right, is definitely would be best. And these things are preventable. So cavities in most cases are preventable. So if you're able to brush and use a fluoride toothpaste and floss, the care partners would be wonderful. The more you're able to help every time you brush or help your loved one, you're able to lower that bacteria load that's in the mouth. Also cleaning the denture at least once a day, soaking it in an antimicrobial. Anything that lowers the bacteria levels in the mouth helps prevent both cavities and also gum disease. And this person, sadly, it looks like they have both. They have a bacterial infection in the gums, called periodontitis, and then it also looks like they have pretty significant cavities, as you can see by the dark lesions on many of the teeth. So just a big picture kind of look at that local infection in the mouth. But then this also then now travels, we've learned, or we're learning more and more in the different studies, linking to other systemic issues in the body.
Just following up on what Dr. Fawcett just said, it's really important if you're at home and you're a caregiver to think about how do you approach a patient like this, and how do you have cooperation so that you can work with a patient like this. If you have a patient at home that struggles with their teeth and you're a caregiver, think of the problems that can ensue on that. If you had this type of issue in your mouth, would you want someone to come in and rapidly brush your teeth? Approach is really, really important. So when you're looking at older adults, go back to those figures that almost all adults over the age of 65 are dentally unstable and have disease. Then if on top of that, if there's cognitive issues, if they have physical issues like arthritis or a stroke, all of these become exacerbated. So it's really important to learn an approach on how you can approach these patients to be effective, because that's really, really key. And I think that's one of the things that Motivate at Home will help offer, is that educational approach to help caregivers step in, know what the approach is, and then how to take care of these teeth. Next slide. This slide here is just an example of, again, when we think of the mouth, we think of that past slide where there's cavities and gum issues and it's hard to eat and things like this. But it's also possible for, on the left-hand slide, there's a big bubble up around some of these teeth where there's an infection, and in that infection is millions and millions of bad germs. Well, they can stay in your mouth or they can travel. And one of the areas that they can travel to is they can travel to areas like the brain, to the lungs, and to other areas in your body. So when we think of teeth, we want to think of just not the mouth, but think of other areas that they can travel to, because they can cause serious problems elsewhere in the body. So that's just to be conscious of where they can travel to, and that part of our job with good hygiene is a good mouth provides good care elsewhere in the body.
You want me to say a little something about the case that?
Yes, go right ahead.
So, sorry, we could go back a slide, please. Thank you. So, sadly, there was a case that got national attention. A 12-year-old boy named DeMonte Driver died from basically an infection in his tooth that went to his brain, and he passed away. And his basically the backstory is the mother did try on many of occasions to get him access to care, to get him into a dental office, and even his primary care practice tried to get him access. And sadly, it got so severe that, again, he ended up passing away, and just shed light back in 2007 some of the challenges that's happening on a national scale. Epidemic of tooth caries, not just in adults, but children and older adults, and then the access to care, to dental care to be able to treat these types of infections.
One other point on this here, this was a young child. When we look at a lot of the patients that we see at home, we're looking at an incredibly vulnerable population. So one of the questions I asked back in 2007 is, why aren't we more motivated to offer certain types of care and treatment for our older seniors? Most have a chronic disease. Most have vulnerable health systems. So these bacteria have more of a chance to travel and cause damage in older adults. So it's a question I still ask, because we're still looking at how do we improve the health of older adults, knowing that these conditions can happen. So next slide, please.
Dr. Brennan, I'll let you jump on this. This is a new study that he brought to our last Motivate meeting. And again, just eye-opening of what we're learning and the new information that's coming out every day.
It is, and this is one of the things that I think that we all should be interested in. And it's just an example of one of the things that can cause from bacteria. And when we look at where these bacteria travel to, I think one of the things that we've learned in dentistry and medicine is you don't find what you don't look for. So for years, we separated the mouth and the body, and we never looked at the mouth as being an issue for vascular disease around the heart. We never looked at bacterial problems that may impact dementia. And so just within the last couple of weeks, there's a Dr. Chung who, in her statistics, looked at bacteria that's in the brain and the toxins that result from bacteria. And if you look at this little yellow highlight, it's pretty amazing that poor oral health is associated with a 17% increase of all dementias. So, and why wouldn't it be? When you think about it, inflammation and its toxins don't stay in the mouth, they travel. It's just that we never looked for it outside the mouth. But now that we are, we're seeing these. Now, when you're looking at how do we prevent these different diseases, with good oral care and education, and that's not only education for the patient, but for all members of the team and families, it's so important, we can reduce these types of issues. So what the inflammation tend to cause is these vascular tangles in the brain, and also the amyloid. It's the material that sort of surrounds all the cells in the brain. Both were affected by bacteria. So there'll be a lot more information that comes out on this, but it kind of highlights not only this cognitive issue, but there's this research that's being done in so many other organ systems. Next slide.
So this slide just kind of highlights the bidirectional, or basically is what we're looking at, is that the periodontal disease and other types of chronic systemic diseases works both ways. So when you have oral diseases, be it, again, gum disease, cavities, it impacts the body and the different body systems. So the example, probably the one that's you'll see most literature on, is diabetes and the links between gum disease and diabetes. And just we've learned that basically people who have diabetes are more susceptible at contracting infections. So it's no surprise that they're more prone to periodontal issues. And then what they're also learning, or we're finding in the literature, is that people that they don't have treatment for their gum disease, they aren't able to afford or have access, or just don't have a dentist that they have seen or don't realize they have a problem. They have trouble monitoring or being able to regulate their sugar or their glucose. So the doctors their physicians working really hard to try to help them, their diet, medications, lifestyle changes. But if they have untreated periodontal issues, gum issues, it could be very difficult to control that. So there is, again, vast literature on that, as well as cardiovascular issues and stroke. We know that heart disease, the risk, the periodontal issues or gum issues can exacerbate existing heart conditions that people have. And then the oral health and dental care, as well as behavioral care, again, that bidirectional, that working kind of both ways and in tangent and affect one another. Dr. Brennan, what are your thoughts on the
I think that's great.
care?
And one of the things, especially on behavioral health, with so many people, especially as we age, and in long-term care and assisted living, many are on depressive drugs, which cause dry mouth. Dry mouth, it affects swallowing, speaking, holding your denture up, and the increase in bacteria is dramatic. But also think of one other thing when we think of this is most of the behavioral medicines cause lethargy, lack of motivation. So here you have a system where we have all this bacteria that's getting in your mouth. And if you normally had good oral health, you may not. You just don't have that motivation to get rid of it. So these are really interconnected.
The next slide.
Nancy?
Yes, so this is a a case that we came up with. It was used in a previous series that was very well received. So we have this case scenario, and this may be neighbor Charles, might be someone similar that to your people that you know, as well as family or friends or people that you go to church with. So the case basically highlights something, again, something that we commonly see in our communities. He is struggling with his health. He has diabetes, type 2. He takes medication for it, but he still has that poor sugar control. And there's a blood test for it called the HbA1c, and anything 7 or more for a diabetic is considered uncontrolled or not well managed. He has an appointment for a knee joint replacement surgery coming up. He recently went to the dentist and learned that he has severe gum disease and is experiencing loose teeth and bad breath. He also shared that he's been feeling depressed lately due to his health issues, and is on medication to treat that. But unfortunately, that makes his mouth very dry. And his wife had mentioned that he is experiencing memory problems and was lost on his way home from the store recently. So again, I think something that maybe many of us, those out there that are care partners, may also relate to this, and sadly. But so we just kind of prompted some questions, and if anybody out there has any questions, we're happy to field those. But we're just thoughts on how can Charles's severe gum problems be best managed. So with that, I would say we were happy to hear that Charles was able to connect with his dentist. So he was able to get an assessment, a comprehensive evaluation, to find out that that he has gum disease, and his dentist I'm assuming dentists will be able to give their treatment plan options. And there's a lot of non-surgical things that can be done. Some deep cleanings or deep scaling and root planings. There's also surgical options that a dentist could assess. But first and foremost, for Charles, I think any practice the dental hygienist or the dentist would be talking about oral hygiene and being able to practice good oral hygiene as best someone can, like using a power toothbrush, perhaps, if Charles isn't using one, being able to integrate flossing, maybe an oral rinse. So just sort of gathering that information, and then bidding on Charles's finances and insurance and his case. His dentist would be able to best make a recommendation as to what are next steps. And definitely knowing the literature and understanding what we know now, that's really important for him to address those gum issues, given that he's really struggling with his diabetes and keeping his sugars under control. It also may impact his knee joint replacement surgery. We know that many practices now are asking for dental clearances to make sure that people are going into a major surgical procedure, having a healthy mouth and teeth and gums, because that way they have better success rates and less issues, or better wound healing, and post-op infection is less if people have healthy gums and teeth. So that's that one, kind of from that perspective. And then the other one, I'll throw this out to you, Dr. Brennan. How might his gum problems impact his overall health?
We've talked about a lot of this just coming up to this slide, but I know we're getting close on time at the end here. But when you think of Charles and you think of all the older adults that are at home, think of Charles and all of these problems. This is not unique. This is a problem that 80% of the older adults will have in terms of chronic diseases and how they affect their mouth. So we know that it's about management. It's about the bacteria that can travel. We know that as the last thing, that memory and things like that can affect overall health. So it's important one of the takeaways is not to look at this as we picked an unusual case to discuss. This is our community, and this is our everyday older adults, and this is what we see in the home. And it's really important that caregivers at home have at least a help up, because you have to think about that, how difficult it is for a dentist to step in on a problem like this. I'm always amazed that caregivers at home have to step up, and they've never been in a mouth and have to deal with these types of problems. Are there any questions? I know the time's getting tight.
Doesn't look like we have any questions. So thank you, Dr. Brennan and Dr. Foster, for speaking today. Very helpful and valuable information. And certainly, as we have future sessions like this, we will certainly be emailing out to those who have attended so that you can participate in future sessions. And I did put the link in the chat for the survey and really ask your feedback. It's very important to our future programs. Thank you.